Omid Masoumali died a slow and painful death over an agonising 2 days. A coroner determined he doused his clothes in petrol and set himself alight in an act of misery and desperation, struggling to come to terms with the reality of an indefinite period on Naru.
The family, the widow, the friends, all the fellow inmates, they are sick to death of this cruelty.
An inquest held in Brisbane found Mr Masoumali almost certainly would have survived if he received adequate and timely treatment. State Coroner Terry Ryan told the court it was clear on the evidence that the clinicians at the hospital did not have the necessary clinical skills, equipment or facilities to deal with Omid's injuries. Despite more than a 24-hour delay in evacuating, the state coroner found those who sourced the emergency flight to Australia did so as quickly as they possibly could, but the outcome was inevitable. He criticised clinicians who failed to consider Mr Masoumali was a higher risk of self-harm after he asked to see a psychologist just days before the incident.
We're continually told a lie, that the medical facilities, medical treatment that's available in those places is akin to what's available in Australia. It's not.
Refugee advocates say the findings prove conditions on the island are inhumane. The state coroner, however, accepted there have been significant changes to healthcare and far fewer people are now being held there. Coroner Ryan said the purpose of the inquest wasn't to examine government policy on offshore detention and treatment of refugees, but he did recommend there was a need to provide more assurances and certainty to asylum seekers about their future, in the hope it will reduce the mental anguish many on the island suffer. Talissa Saganto, ABC News, Brisbane.